In this tutorial, we will show you how to run a complete study with your Labary Portascan 3D. To start, press the power switch on the lower right-hand side of the system to turn on your Portascan 3D. The system will do a quick calibration check as it turns on. The Portascan 3D is a non-invasive adult bladder scanner. It can be used to measure a full bladder, the residual volume after urination, or to help judge the need for catheterization. You can enter patient information and select their gender with the toggle in the top center of the screen. Use the female setting for both pre- and post-hysterectomy patients. The patient should be lying supine and stationary to begin. Locate the pelvic bone and place the ultrasound gel 2 fingers width upwards from it in the center of the patient's abdomen. Apply ample ultrasound gel to ensure a clear image is taken. Position the probe with the button facing upwards towards the head of the patient. The probe should be at a 45-degree angle aimed towards the anus. We suggest using 2 hands to hold the probe and keep continuous and consistent pressure while locating the bladder and scanning for an accurate volume. Press and hold down the probe button for a live pre-scan image. Locate the bladder using the green guideline to center your image. Once the bladder is located and outlined in green, release the probe button and apply steady pressure while holding the probe stationary until the beeping stops and the scan is complete. If the patient has a large abdomen or pannus, move it up and out of the way and scan lower on the abdomen. Do not scan directly over scars. This may obstruct the scan. It is critical to hold the probe still during the scanning phase, as 12 separate images of the bladder are taken during one scan to calculate an accurate volume. The bladder silhouette should appear in the center of the crosshairs. If it does not, you may need to repeat the scan with the probe at a different angle. Adjust the angle to move the bladder image towards the center. You may find that applying more ultrasound gel, applying more pressure, or adjusting the gain is necessary to improve the scan. Once you obtain the first scan, you can perform a second scan to validate that accuracy is within 10%. On the right side, the volumes for the last 5 scans will be displayed, with the largest volume at the top of the list and a green arrow beside the last scan performed. If desired, you can store the image for the patient by pressing the Save button. When ready, simply press the Print button, and the internal thermal printer will generate a report. You have successfully completed a patient study with your Labary Portascan 3D.